Hi everybody. Today we're going to talk about joint mobilization techniques for the shoulder, specifically the glenohumeral joint. So let's say we have our patient here, Miranda, who is struggling with shoulder abduction range of motion. By the way, today the apparel representation for Rowan is the Rowan headband. But let's say she has limited abduction, maybe she had surgery or an injury where she can only get to about 80 or 90 degrees of abduction. Of course, remember we can use the wand technique. So her good arm is helping her injured arm up into abduction. Remember, if she's struggling with external rotation range of motion, we can work this at 0 or 45 or even 90 degrees of abduction. But let's just do 45 degrees for now, and she's doing a passive external rotation with the wand. To supplement that, remember we need some joint gliding to take place for normal shoulder range of motion. So let's go to the board for a second. So here we have the scapula and the humeral head. The glenoid fossa is concave and the humeral head is convex. So in order for the humerus to abduct, you have to have some inferior glide, as demonstrated by the green arrow here, for that normal abduction to take place. If you don't have enough glide occurring between these two surfaces here, you're not going to be able to get full abduction. So with the convex concave rule, we have a stationary concave surface in the glenoid fossa and a moving convex surface with the humeral head. So the glide must happen in the opposite direction of the joint movement. So in other words, the glide has to happen inferiorly as the shoulder abducts in this direction. We're trying to keep things positive. Hello. So here are our joint mobilization techniques. First off, the shoulder for the glenohumeral joint, the loose packed or open packed position is about 55 degrees of abduction. So we're going to put her in that position here. And the first one we're going to call an inferior glide, where I'm going to put my hand up in her axilla and actually separate the humeral head from the glenoid fossa. So I'm gliding out laterally. That's my traction. This is not actually the glide. I'm just applying traction to the joint first. I have her hand tucked into my elbow against my waist. And then once I maintain that traction, I'm going to glide inferiorly here. So this is a longitudinal inferior glide. Now let's say we get her to about 90 to 100 degrees, and that's kind of her sticking point. We can do inferior glides at specific positions from a different angle. So I have her hand against my waist here, and this is where I'm going to apply my traction. I'm going to use my web space right over top of the humeral head, and I'm going to glide inferiorly this way. Now she has a lot of joint play. Some people might not have that much, but we're doing an inferior glide. So if I were to do a grade 1, remember that's just the first 25% of the motion. If I were doing a grade 4, for example, I'd glide her all the way, back up 25%, and do the last 25% repetitively. 2 to 3 glides per second. And we can do that at multiple angles. If we needed to glide her posteriorly, come on over to the edge of the table. You can apply a little bit of traction here. Again, her hand is against my waist, and I can apply a posterior glide this way. Posterior glide would be to improve shoulder flexion. So from here to here, this shoulder flexion motion, to improve that, we need to glide posteriorly. Remember, because everything is the opposite direction with the shoulder. And to glide anteriorly, go ahead, lay on your stomach for me. Just flip over here. And I have more of a straddle position here. I'm going to have her closer to the edge of the table. She's going to hang with her elbow about 90 degrees, so it's relaxed. I'm going to, again, apply a little bit of traction and use your body. You don't necessarily have to use too much muscle here. Use your body just to rotate. And just going to tighten the sleeve up a little bit so we can see. And I'm going to apply an anterior glide like so. So applying some traction and anterior glide. This is to improve shoulder extension and also to improve external rotation. Remember, the glide has to happen in the opposite direction, so it glides anteriorly when we externally rotate. Now sometimes with the shoulder if there is a limitation at the sternoclavicular joint, that could affect shoulder abduction or shoulder retraction. So for example, in order for the shoulders to retract properly, the way the sternoclavicular joint is arranged, the proximal clavicle must glide posteriorly. So to do that mobilization, we would place both thumbs over the proximal clavicle here as if in a strangle hold position, like you erase my American Idol recording. So I'm placing my thumbs here. Be careful not to use your thumb tips. Use the flat parts of your thumb, and we're on the proximal clavicle. And we're gently mobilizing the clavicle in a posterior direction. Again, 2 to 3 glides per second. Make sure there's no injury there at the sternoclavicular joint, because there are important arteries and vessels behind there that we don't want to glide posteriorly if this joint is unstable. To improve shoulder abduction, okay, we talked about mobilization of the glenohumeral joint, but this joint here also has to glide inferiorly for abduction to occur. So to mobilize the proximal clavicle inferiorly, again, using the flat parts of my fingers, I'm going to mobilize like so in an inferior direction. Again, try not to dig with your fingertips. Leave your fingers flat like so. That's all I have for today. Remember, your joint glides are 1 through 4, depending on what you're looking for. Grades 1 and 2 are for reducing pain, and grades 3 and 4 are for increasing mobility. See you next time.